Hi, this is Steve Chang signing in today, trying to give you a hand on how to do a Medicare Part D medication program. So, as a lot of you know, what you're going to see is that the open enrollment for medication programs, Part D, goes from October 15th to December 7th every year. So you have this time frame to do the paperwork, to sign up, so that's effective on the following January 1st. Now, this is not for Medicare supplement plans. Most of you have Medicare supplement plans. It is not the open enrollment for them. So let me get that clear. Those are the plans that deal with your doctors and hospitals and labs. Medicare supplement plans only have their own special birthday, California birthday rule law. On your birthday each year, for 30 days after your birthday, you can switch to another Medicare supplement plan without any health questions for plans equal or less in benefits. Most of you, almost 99% of you, have Plan F, which is the strongest. You can buy another Plan F. If for some reason that plan is so expensive it's gone out of reach, you can always switch to another Plan F. No health questions, so you can switch automatically. Just a thought, okay? Now, in regards to how to choose a medication program, don't forget is that we can open up, for example, let me give you a quick background here on Medicare Part D. So, if you look at a piece of paper and look at it in thirds, so the first third of the page, this is how medication program works. First $3,000 on costs, and I'm talking approximate, okay? It will change a few dollars here and there every year, but approximately the first $3,000 retail cost of medications, you're going to pay copays, 0, 10, 45, 85. It just depends what your drug is and what company you're dealing with, but you'll pay copays until the $3,000 of drugs are taken care of. Then you go into the infamous donut hole. This is where of the next $1,700 of medication you pay for out of pocket 100%. You do get a special deal with the new healthcare reform law where they've swung a deal where you pay 50% of the brand name costs and 94% of generic costs. But basically, you're going to pay all the $1,700 out of your pocket. So that's your middle third. On the last third, it gets cheap again. So going back, the first third, it gets cheap. Middle part, it's all yours, 100%. And then on the last third, it becomes cheap again. So it's $2.65 for generic drugs, $6.60 for name brand drugs, and 5% for specialty drugs. Specialty drugs being like, I don't know, Embro, which is really expensive, like $300 a shot. So those are the things I cover. Now I'm going to go into the website and show you how you can go. You go into Medicare.gov, and this is how you shop for a drug plan. So now, many of you will have to shop around because you have new drugs or you've taken off drugs, and you want to make sure that you're getting the best plan possible. So I'm going to show you how to use it. So you're going to go into this website, and this is for the 2014 year. Find health and drug plans. Click that. It'll take you to the next page. Put in a zip code. I'm going to use our office at zip code 94903. Click Find Plans, and they're also going to ask you from there what you have. So most of you have Part A and B of Medicare, which is called Original Medicare, and most of you don't get any help paying for these things. So you're going to say, I don't get any extra help, and you hit Continue to Plan Results. From there, they're going to ask you what kind of drugs do you take. I'm going to write down, for example, Lipitor, which is really popular. It's the most profitable drug in all of America, hands down. So they'll give you a list of what they think is Lipitor, something with L's. You click it over here and hit add the drug. Tell you what dosage you're taking. The most popular dosage for Lipitor in America is 40 milligrams once a day. And yes, I say add the drug and dosage. And from there, they're also going to ask you, what do you want, the generic or the name brand? In this case, you have both. So I'm going to check for the generic. Atorvastatin is the name of it. I continue to click that. Also, let's say you have another drug. And this is what you would do if you had 8 or 9 drugs or 2 or 1, whatever. Just keep putting in your name of the drugs. So I'm going to check in lisinopril. This is for high blood pressure. I'm going to take 40 milligrams once a day and add drug. Now, this particular drug is already generic, so they don't give me the choice of name brand generic, it's just generic. Let's say those are the only two drugs I took. I said, I'm going to click my drug list is complete. Click that on the very bottom here. And what will happen is, which pharmacy I use? I'm going to say I choose Walgreens. You can choose whatever you want, whatever's in the neighborhood. And if it's not in your neighborhood, click the mileage and it'll find one that's close to your zip code, that the pharmacy. And most all pharmacies are part of the network, by the way. Click continue plan results, and what will happen, they'll ask you which one you want to see. Well, you want to click for the standalone prescription drug plans. They're also called, when you see these things called PDP, it's called short for prescription drug plans. And these are standalone. So continue plan results, and then you'll notice there's 31 plans available in this neck of the woods for standalone drug programs. Click that. And what will happen, it'll come up, the Medicare.gov website will pop up the best plan for you. Now notice you'll see lowest estimate annual drug costs. You have other options you can do for mail order, all that kind of stuff, but I'm going to say lowest estimate, and the pop plan that came up was this one. Now keep in mind there's 31 of them. In this one you're going to see 10, but you can also click over here to see all 31 if you want. I'm not going to bother doing that, but you can to see what's out there. Now in this particular plan, it's $22.40 a month, but that's not what I'm looking for. I don't care about that. What I'm looking for is the most out of pocket. So this plan is going to cost me $269 right here a year for those two drugs. And the way it works, you click the hyperlink for this plan and see the results. And it happens with all the plans. So sometimes they'll start you here with overview. I don't want you to see that. What I want you to see is go to drug costs and coverage right here. And it'll give you the cost is $22.40 a month, but that's not the important feature. What I want to see is going to be costing me $268 out of my pocket. This includes the $22.40 and whatever I would pay out of pocket. That's how that's why this particular plan was the best one for this particular situation. This was the cheapest of all 31 plans. Okay, what they're telling you over here is that your atorvastatin, which is the generic Lipitor, is $9.50 a month. Lisinopril is $4.12. So these are really cheap. So it's $13.62 for a month's worth of meds. Of course, this is not typical. A lot of you have really expensive drugs, so keep that in mind. And what they're telling you at Walgreens, they're not going to let you have you pay any copays. It's free. So the cost is the $22 a month, basically $22.40 a month. So what they're telling you here is $22 a month times 12 will give you the idea that it's going to cost you $268.80 a month if you multiply by 12. And that's how you get a program. And this is the best program for you. Okay? So every year you can do this. Now don't forget, it's between October 15th to December the 7th, Pearl Harbor Day. Now, the reason why they don't do December 31st anymore, they got sick and tired of seniors bitching and moaning that on December 31st they would sign up and complain on January the 2nd that they weren't up and running. You have to give them some time. So they said, forget it. We're not going to give it. We're going to cut down the open enrollment time frame. And that's just the way it works.